Ramirez was visibly distressed with labored breathing and an erratic heartbeat, prompting immediate attention from the medical staff. However, as they began treatment, something wholly unforeseen occurred. Nurses and doctors started to fall ill themselves, overwhelmed by fainting spells, nausea, and a sense of disorientation. The situation escalated rapidly, with some staff members being so severely affected that they required hospitalization. The core of the mystery centered around Ramirez herself, who emitted an unusual fruity, garlic-like odor. When a blood sample was drawn, the syringe contained manila-colored particles floating in the blood, further deepening the enigma. Attempts to stabilize Ramirez proved futile, and she tragically passed away that same night, leaving behind a baffling medical riddle. The hospital was evacuated, and a hazmat team was called in, turning the emergency room into a scene more akin to a biohazard crisis than a medical facility. Initial theories speculated about Ramirez having been exposed to some form of toxic substance, possibly related to her use of dimethyl sulfoxide, DMSO, as a home remedy for pain, which under certain conditions could metabolize into dimethyl sulfone and potentially further into the highly toxic dimethyl sulfate. Despite extensive investigations, including an autopsy conducted under rigorous containment measures and numerous tests, a definitive explanation for the toxic symptoms experienced by the hospital staff eluded scientists and toxicologists. The official cause of Ramirez's death was determined to be complications related to her cervical cancer, but the bizarre reactions of those who treated her that night remained a puzzle. Various theories have since been proposed, ranging from the biochemical to the psychological, including the possibility of mass hysteria, amplified by the stressful conditions of an emergency room. Yet none have fully accounted for all the observed phenomena, leaving the case a subject of ongoing fascination and debate within the medical community and the wider public. The story of Gloria Ramirez poignantly reminds us of the limits of our understanding of the human body and the complex interplay between chemistry, biology, and environmental factors. It underscores healthcare professionals' challenges in diagnosing and treating uncommon conditions and the importance of preparedness for extraordinary medical scenarios. Above all, it highlights the enduring human quest for answers in the face of the unknown, which propels scientific inquiry and exploration.